Dr. Amber Robbins from Highland Family Medicine is back with us. Doctor, as always, good to see you.
It's good to see you. Good morning.
Good morning. Our conversation today revolves around long-acting reversible contraception. Certainly a topic of interest to many women, that's for sure. Let's talk about the argument for long-acting reversible contraception. Why would a woman choose to go this route?
Right. So a lot of times we think about birth control as just being the birth control pill. And, you know, that is a good option. The hard thing with the pill is that you have to make sure you're taking it every day, and you're supposed to take it the same time every day for it to be effective. So having the long-acting reversible contraceptive options are a good fit for women who can't remember those things. So that's an advantage of it, that you do not have to take it every day. So another advantage of it is that if you have any of those issues of abdominal cramping, really bad periods, this may be a great option for you because it will actually reduce some of those symptoms. And the last thing I would say is a huge benefit of it is that it can help reduce the flow of your period. So if you have really bad, a lot of flow in your periods, it can decrease that, and it, for some women, can even stop your period.
What options are available for women? Right.
So the two options that we talk about most are the IUD, which is the intrauterine device, and I have one here. It's really small. A lot of people think that it's bigger than it is, but it's a small device that goes into the uterus. And another one is called the implant, or the Nexplanon Implanon, and it goes into your arm, and again, it's small. It goes right there into the arm, and both last a long time. The implant lasts about 3 years, and the IUD can last 3, 5, or even 10 years.
Okay. Are there disadvantages to using these particular devices?
Right. There are disadvantages to everything we do, either, whether it's food or anything that we put in our body. So the disadvantages for this are sometimes putting in the IUD or the intrauterine device can be a little bit painful, some cramping that you can have. And then for the implant usually goes in really quickly, and really lower risk for that. But with anything we put in, you can have a risk of infection, you can have a risk of discomfort, like I was saying before. And also, the thing that we like to counsel women about is that with both of these, you have a risk of having an ectopic pregnancy. And what that is that we have the uterus, and then we have the tubes that are on the side of the uterus. A pregnancy can happen in the tubes that are on the side of the uterus. And if that happens, which are the fallopian tubes, if that happens, and that's called an ectopic pregnancy, and that is a medical emergency.
All right, so a potential risk there to keep in mind.
Yes.
Lastly, and women should be aware, if you use these long-term options, you still can get pregnant.
Oh, yes. And that's the reversible part of it that is really good. So if you do want to get pregnant, you can have these removed even earlier than the amount of time that they last for. And I have found some women even getting pregnant the week after we remove them. So it's very possible.
Right, so you can still choose to get pregnant.
Yes,
I guess is the better way to put it on my part. All right, doctor, thank you. Important conversation. We appreciate it as always. We'll share some more information along these lines on our website. You'll find those links at RochesterFirst.com.